So let's just jump right in, shall we? The first thing that I love that patients do is when patients come in, yes, I'm talking about you, when you come in with either a bag of meds, right? A bag of all your medications, or a medication list with dosages, okay? And timings that you have in your wallet or your purse. I know, I mean, it's the little things, right? We doctors, we care about little things. But I just love it. And you know why, guys, because I mean, and I've been a victim to this too, or rather I've been a perpetrator of this, even as a doctor. We say the little blue pill or the little white pill or the round yellow one, but we may not know the names or the doses or how often we're supposed to take the medications. And honestly, to us docs, that is golden. So, I love it. I love it when my patients bring, literally, I see them walking down the hall with a bag of meds. So if that's what you need to do, hey, don't be shamed. We love it. Or just make a list and keep it in your purse or in your wallet. Okay, so the next thing is something I really love when patients have, and that's understanding, especially when we doctors run late. And look, I'm just going to be real with y'all, and I'll say it. I typically run probably about 30 to 35 minutes late in the office. I'm so sorry about that. Honestly, I apologize when I come into the office. I really hate it because I really do respect your time. And I know that sometimes patients feel like we don't respect their time. Why do we run late? Well, for many different reasons. I usually get about 15 minutes with a patient. And if I spend an average of 20 to 25 minutes with each patient, I'm just going to start running behind, which often happens. But other things too. Sometimes we have to call other doctors to get information about you, or we have to get records or things like that. But I'll tell you, I love it when you guys are understanding or at least kind to us when we're running late. We don't mean any harm. I hope your doctor is nice about it if they're running late, by the way. They shouldn't be a bleep, you know, right? We should be nice about it and respectful about it. But for all of you guys that are understanding when we're running late, I can't thank you enough from the bottom of my heart. I promise you, I'm not in my office on Facebook, okay? I'm not playing Candy Crush and just not seeing you. So understanding, so huge. So number 3 is I love it when you guys come in prepared with any paperwork that you need to have done. I mean, there's nothing worse or scarier than like having back to school paperwork or sports physical paperwork or summer camp paperwork or anything like that, college physicals that have to be done right away, and we may not be able to get that done for you because maybe you need vaccines or you need lab work or whatever. So that patient that plans ahead, yes, I'm talking about literally plans weeks in ahead, gets all the paperwork together and comes in advance with kind of everything organized. It really helps both of us because it means that we don't have to delay you getting started with that next chapter in your life. And it also makes things go smoothly. So for you guys out there, like rocking out with paperwork, like, thank you. Really, these are not small, huge. So thank you guys. Okay, number 4 is I love it when patients come in organized regarding their symptoms. So, I mean, and first of all, I'm a patient too. And how many times have I been to my doctor and I forget half the things I wanted to talk to them about? It's so easy to do. So I actually have to write down the things I want to talk to my doctor about or make a little list on my phone or whatever. And I have a lot of patients that do this too. And I really appreciate it. And I'll tell you why. It's because especially when a patient has like a lot of symptoms, you know, maybe a lot of things have been going on in your life. Maybe you've been feeling kind of down lately. Maybe you've been struggling with some back pain. Maybe you've also been having extra heartburn, and I don't know, maybe you've got like a sore on your leg. You come in. When patients tell me that they have a number of things they want to talk about up front in the beginning of the office visit, it's so awesome because what it means is we can prioritize what's really important. And we can say, all right, so you got all these things going on. Let's pick the 2 or 3 things that are most important to you and start there to make sure that we do everything adequately and we're not like blowing stuff off, right? And then, you know, we can work on the next stuff as we come. And you know what, guys, that's so important when it comes to things like chest pain and stuff. Because as a doctor, I can't tell you how hard and how helpless I sometimes feel when I may be spending all this time on your diabetes and your acne medication and all this stuff, and then at the end, a patient mentions their chest pains, which of course is super important and probably more important than all the other stuff. So for all you patients out there that are like rocking out with the organizational that are rocking out with the organizational skills, that you're kind of coming in and saying, hey, look, I got a number of things I want to talk to you about, and you're letting us know up front, thank you, because again, it helps us help you. And if you're not doing that, no problem, no sweat. You can start doing that in a jiffy. But it's super helpful. It makes it a lot easier for all of us. So the fifth thing is, I love it when my patients are chatty. Yes, you heard me right. Well, I'm a very chatty doctor, but that's not why I necessarily like it when you're chatty. I love it when my patients are chatty because you know what? I get to learn a lot more. I want to know stuff about you. I want to know what you think, how you feel. Did the medicine work? Did it not work? Are you happy? Are you sad? What you think? I want to know if your meds are too expensive. I want to know if you're having bad side effects. I want to know if you just if you don't believe what I'm saying. I want to know what your cousin told you down the road, okay? I want to know why you weren't able to get your colonoscopy or your mammogram, or why you haven't been in for blood work. Is it because you're afraid of needles, which I have patients who are? Is it because the copay is too high, which maybe I can help with? Is it because of something else? So, the chattier that you are, the better it is for me, because I get to learn so much more about you, and I can help you even more. And getting to know you, and especially as a family doc, I mean, again, I'm chatty, okay? Wah, 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 wah. That's me. Okay. That's why I became a family doc, because I love getting to know my patients. So just remember, it's okay to be chatty. Tell us what you think. Speak what's on your mind. Tell us what you're concerned about, what you're afraid of, what you're happy with, what you're not sure about. Because really, we're here to help, right? We're here to hopefully make your life a little healthier. So that's all I got for you today. Maybe I'll do this periodically and give you some more tips as we go on and things that we love about patients, or I love about patients. Anyway, guys, thank you so much for watching today. As usual, if you want health news that you can use on a daily basis, or if you want to know about that quirky health stuff, like weird stuff, that's me. Or if you like celebrity health news, I do that too. I love that. Just make sure you click the subscribe button and hit the little bell to get updates. Thank you.